Generally, when people come in with hip pain, it's bothering them enough that they wish to seek treatment. It's something that's impacting their lifestyle. It's changing the way they have to do things. They're giving up activities, or they can't do the activities they used to do. They're thinking about using a cane or a walker, something that they hadn't considered before. So this is the time when they usually come in and either see their primary care physician, have gone through a course of physical therapy, have tried different types of medications to help alleviate the pain. So this is generally when we start to see the patients in the office. So when the patient first comes to see us for hip pain or hip problem, they may or may not have had x-rays. New x-rays might need to be done that were different than the x-rays that were done. Some people come in with MRIs. So we're going to review initially with the patient their history, find out what's bothering them, where the pain's located, when it bothers them, what they've done in the past to treat their pain. Someone comes in and tells us that they have a very limited ability to walk, they have pain that wakes them at night, they have stiffness in the morning. These are things that are going to start to think us about, okay, well, this person has some fairly severe arthritis that may be needing surgical intervention, opposed to someone who's having intermittent pain, hasn't had physical therapy yet. So these are the people that we may say start with conservative therapy. So depending on what condition they're at when they come in, if they know they have bad arthritis and they're coming to talk about surgery, then they should be prepared to ask certain questions about what sort of approach do you use, what sort of implants do you use computer navigation, and then also questions about their hospital stay after the procedure. Depending on what the procedure may be, if they're having a hip arthroscopy, it's an outpatient procedure. They expect to be on crutches for about 10 to 14 days after the surgery. They begin physical therapy at that point. And then usually by 3 months, they're starting to resume some normal activities. Swimming, biking can be done early on. If they're going to be having a hip replacement, they expect a hospital stay anywhere from 2 to 4 days. And then depending on how they're doing in the hospital, they may need to go to a rehabilitation center afterwards to get more therapy, or sometimes people go directly home with a physical therapist that will come out to their house. And then usually with the hip replacements, by 3 months, they're starting to get away from their walker and maybe transitioning to a cane. By 6 months, they're realizing that this was a good choice for them. Additionally, most tell people, your outcome at a year is kind of where you're going to be. You can continue to improve somewhat, but for the most part, it takes a year to fully recover from pretty much any surgical procedure. Most of the time, patients will come in and tell you that they're very happy that they did it. They don't think about their hip anymore. They're back to the activities that they wanted to do. And that's, very satisfying for everybody involved.